welcome to the Happiest Health webinar, Observing World Kidney Day. I'm Sunita Rao, Senior Editor, and we'll be talking to the expert nephrologist from Bangalore, bursting the myths about kidney health. Sitting in the back of our abdomen are two bean-shaped organs called kidneys. They take care of removing the waste in our body by filtering the blood and maintaining the fluid balance. There are multiple myths about what is good for our kidneys without any scientific backup. Happiest Health's webinar today, on account of World Kidney Day, debunks such myths about kidney and brings you the facts about kidney health. In today's webinar, we have two eminent nephrologists joining us. Dr. Sundar Sankaran, nephrologist and program director, Aster Institute of Renal Transplantation, Bangalore. Welcome to you, Dr. Sundar.
Thank you. Thank you.
In his illustrious career spanning 4 decades, Dr. Sunda has experience of managing over 3,000 kidney transplants. 3,000, that's huge. He has special expertise in the management of complicated kidney transplants, palliative nephrology, and geriatric kidney transplants. He's one of the co-founders of Karnataka Nephrology and Transplant Institute, which was called Kanti and founded in the year 1991. Dr. Sundar is recipient of Dronacharya Award for services in the field of nephrology. He is a former adjunct professor of nephrology at Manipal Academy of Higher Education, a founding member of the Indian Society of Organ Transplant, Peritoneal Dialysis Society of India, and the Nephrology Association of Karnataka. Welcome to you, Dr. Sunda. Another eminent panelist with us today is Dr. Deepak Kumar Chithralli, Senior Consultant, Nephrologist, and Transplant Physician at Manipal Hospitals, Yeshwanthpur and Hebbal in Bangalore. He's a highly qualified and experienced super specialist in the Department of Nephrology. He specializes in renal transplantation and has played a key role in more than 500 renal transplants, including both live and deceased donor transplants. He has special expertise in ABO incompatible kidney transplants, handling marginal donors, complex kidney transplants, and pediatric transplants. Welcome to you, Dr. Deepak.
Thank you.
So let me begin with the first round of questions. Dr. Sundar, if I can ask you, there's a lot of misinformation about critical health issues, including that of kidney health. For example, to say that CKD, the chronic kidney disease, is rare. What are your concerns about such myths?
The myth that chronic kidney disease is rare itself is wrong. In fact, we have a saying, chronic kidney disease is common, but that is the bad news. But the good news is it can be detected early, and if detected early, it can be treated. So that's the myth. The myth that chronic kidney disease is rare is not correct. In fact, one of the common causes of chronic kidney disease is diabetes. 30% of all diabetics some point of time will get chronic kidney disease. In our own country, India is the capital of the diabetes capital of the world. And my good friend Shashank Joshi from Bombay tells me every 5th Indian is a diabetic and every 5th diabetic is an Indian. And that itself will show the magnitude of chronic kidney disease we are going to get. I can say it's a pandemic of chronic kidney disease. So in short, chronic kidney disease is common, but it can be detected early and can be prevented.
That's well said, doctor. We are also a country which has highest number of diabetics. So every person who has diabetes is equally prone to develop chronic kidney issues unless it's taken care of. Thank you for this information, doctor. If I can ask Dr. Deepak, another popular myth is that chronic kidney disease is curable without intervention. How do you help persons with CKD understand this and navigate with their better health?
Yeah. So this is a common question, that most of the common people have. The first question is the kidney disease curable? We need to understand that the kidney disease has 2 main types. One is acute kidney disease, and other one is a chronic kidney disease. Now, what is curable is acute kidney disease or acute kidney injury, which happens within few days or few hours due to various reasons, like, infections can cause acute kidney injury. Sometimes excessive unsupervised intake of painkillers can cause acute kidney injury. Dehydration can cause acute kidney injury. Now, these are all reversible type of kidney injury. What the chronic kidney disease is irreversible. Any kidney disease which is existing beyond 3 months and is progressing is called as chronic kidney disease, and it is definitely not reversible. So that's a myth that chronic kidney disease is reversible. Now, the chronic kidney disease itself has various other types. It can be caused due to various reasons. For example, it can be due to congenital problems. It can be due to diabetes and hypertension, which Dr. Sundar was mentioning. That can cause a chronic kidney disease. So this causes irreversible kidney disease, and that is definitely not reversible.
I got that. Doctor, he did mention about CKD being not reversible at all, and it can only be treated with either transplant or via dialysis. But it brings me to ask you, you recently posted, on social media about how barley water cannot reverse CKD. Earlier, there were similar attributions also made to the fruit of papaya. So could you explain me more on this?
I think that tweet of mine on how barley water cannot cure kidney disease became sort of viral and also controversial. I mean, I was told by a lot of people. But the point is very simple. If could cure chronic kidney disease, as Deepak very rightly said, if chronic kidney disease is reversed, then it's not chronic actually. And if somebody can cure chronic kidney disease by barley water or papaya, it's a myth. So papaya is a good fruit for kidney patients because it contains low potassium. Many of the times patients with chronic kidney disease come and ask us what fruits they can take. We say don't take banana, don't take pomegranates, no dry fruits, no nuts, because they all contain coconut water, they contain high potassium. Relatively low potassium is papaya. So people also say papita, can I take papaya? Papaya is okay, but it is not going to cure kidney failure. I wish it was so simple. So all the papaya farmers, they should not get kidney failure at all. So papaya will not cure chronic kidney disease. It's a good fruit to have because relatively it has low potassium, so it's safe to have with people with kidney failure.
So the barley effect is not seen at all, is what you say?
The barley water is good for I mean, it's a good hydration. So even beer is good. Beer is from barley, so you can use that also, but you'll end up with liver problem. So basically, good hydration prevents a lot of kidney problems because it prevents urine infection, and that's the important thing. So barley water in that way is good for hydration, but it's not going to cure anybody with kidney failure or kidney disease. It can be just an adjuvant in the treatment of kidney disease.
It cannot reverse CKD, is what you mean? Yeah.
Yes,
Thanks for that information, Doctor.
I wish it was true because that will be the easiest solution for us. We can start a barley joint or something like that and make a lot of money.
Yeah. Dr. Deepak, if I can ask you, we've seen that many think that there are no symptoms initially with kidney disease, and hence the disease-free, and hence one could be disease-free for not knowing any symptoms. But what are the most common symptoms that can be probably early picked up, or are they always unnoticed? How do you clear this confusion?
See, kidney diseases fall into a category wherein we can call them as a silent killer or silent diseases. There are many diseases for mankind which are relatively silent, and kidney disease is one of the most important disease among them. Of course, there are some symptoms and there are some alarming signs as well, wherein the patients experience such symptoms when they have kidney disease, something like swelling of the legs or facial puffiness, excessive tiredness, exertion, or easy fatigability sometimes, and in the later stages, they can have breathlessness or the breathing issue. And sometimes they also do have nausea and vomiting. So, having said that, if you analyze all these symptoms, they're generally vague, isn't it? Nothing is specific to the kidney. So, you have a lot of non-specific symptoms because the waste is removed by the kidney. The main function of the kidney is to remove waste, and the waste accumulates in different parts of the body, and that leads to producing such variety of vague symptoms. So these symptoms are non-specific, as I said again, and that's why most of the people do not come to the hospital or do not come to the doctor or a nephrologist to take advice, because most of them, sometimes a simple example, they have nausea and vomiting, they feel probably it's a gastritis, and they just keep quiet. Sometimes they have fatigability or weakness or breathlessness, they check hemoglobin is low, they feel it is just anemia. But for the fact is, anemia is a part of chronic kidney disease. Gastritis itself is a part of chronic kidney disease. So the underlying etiology or the underlying reason is the kidney disease. And this is about symptoms, but most of the patients, particularly who are non-diabetics and who do not have hypertension and who are young people, we see a lot of kidney disease in young people. They just walk into the OPD saying these non-specific symptoms, or sometimes on the general health checkup they did creatinine and creatinine was 5, 6, 7, or sometimes 10 as well. So they would be not having any symptoms, and that's why it's called as a silent killer. It's unfortunate that kidney disease doesn't produce any symptoms. Otherwise early detection would have been possible. So we need to rely on annual health checkups, doing a simple urine routine and ultrasound of the kidneys and the serum creatinine. These are the most important tests which will help us to detect kidney disease early, because it is most of the times asymptomatic.
Thanks, doctor. That information on the proactive kidney screening, I think, is going to be helpful for many who probably think they have no symptom and they're absolutely healthy. Yeah, that brings me to another question, if I can ask Dr. Sunda. Could you explain us the connection between anemia and chronic kidney disease, doctor? How does the low iron levels give us a hint?
I think Sunita, you raised a very important question of anemia and chronic kidney disease. In fact, Deepak very nicely said. In fact, in the last so many years of my practice, I have seen senior professors managing anemia thinking it is iron deficiency anemia. We must remember the anemia of chronic kidney disease is not due to iron deficiency. The kidney is not just excreting or purifying blood. It has got various other functions. In fact, it's an endocrine organ. The kidney makes a substance called erythropoietin. This is like a hormone which will keep the hemoglobin up. So if somebody has kidney failure, this hormone is less, erythropoietin less, and then the hemoglobin comes low. That is why it's called anemia of chronic kidney disease. In fact, the key should be, if somebody has got anemia and if there is no iron deficiency, it should be an anemia of chronic kidney disease or anemia due to some other chronic disease. So that is a key factor. In fact, I know quite a few people with anemia. They have been treated with so much of iron. I keep jokingly saying they have become like a magnet. You bring a magnet, they start rotating, north-south action, because they've got so much iron. So somebody who's got anemia, as Deepak very rightly said, we must suspect kidney disease, because chronic kidney disease, the symptoms are many. In fact, very rightly Deepak mentioned about vomiting. I must tell you, this is a practical experience I see every month in my practice. Every month I get a young lady who's got married, goes on honeymoon, comes back vomiting, and the whole family is rejoiced. They think new addition to the family, and the vomiting is due to morning sickness. But invariably it's kidney failure. And when I tell the young couple that you got chronic kidney failure and the vomiting is due to that, they're shattered, because this is an event they have to celebrate, and I'm giving them the bad news. I become the bad person. So as Deepak rightly said, chronic kidney disease can masquerade when it reaches end stage into any department. They can go to the gastroenterology department with vomiting. They can go into the lung department with breathing difficulty, cough. They can go to the skin department with itching, urinary pruritus. In fact, the commonest cause of itching in India is mosquito bite, not kidney failure, but kidney failure advanced can cause itching. They can go into the heart department with chest pain. So they can go into any department, or the neurology. They can go with convulsions or fits. They can go into coma. So these are all symptoms of advanced kidney failure. And very rightly, Deepak said chronic kidney disease is a silent killer. Apart from knowing the symptoms, what he rightly said is the test called serum creatinine. In fact, my good friend Dr. Palal has coined the term. It's called the kidney number. If you say serum creatinine, they don't know. They say, what is your kidney number? That is serum creatinine. That will give a clue that you got kidney failure. Coming back to anemia, there are many causes of anemia. The commonest cause in India is iron deficiency anemia, especially women, because they have menstrual cycle going on, so bleeding is low. That is the commonest cause of anemia. But the chronic kidney disease anemia is a different anemia. But patients with chronic kidney disease can have iron deficiency in addition, because in India that's common. But this anemia is different. It has to be treated differently. Just giving iron is not going to solve the problem. You'll have to give an erythropoietin substance, just an injection. Now we have got oral equivalents which can correct the anemia.
Further, that's very informative, doctor. I have another related question to ask you. Many think that only difficult when a person has difficulty in passing urine, that could be a sign of kidney disease. But what about persons who end up facing frequent urination? Is that also a worrisome factor? Could you throw some light on this, doctor?
I think Sunita is a very important question, because whenever you tell somebody about kidney problem, the first thing they say is, I'm passing a lot of urine, sir. A lot of urine also is kidney failure. You must understand the kidney filters 200 liters of water every day. Out of that,
200 liters. Could you repeat that, sir?
200 liters of water or fluid is filtered by the kidney. 196 liters is reabsorbed. About 4 liters of urine comes in. So even about 10% of that reabsorption mechanism is gone. Imagine you will have 20 liters of urine. So you can pass large amount of urine. In fact, we say passing urine in the night, nocturia. Somebody gets up frequently, that is also a sign of kidney damage. It can be kidney failure, it can be prostate, but kidney related problem. Or polyuria. Normally polyuria means passing more urine, which occurs invariably in diabetes, but also in kidney failure, they can have more urine. So I always say passing less urine, also kidney failure or kidney damage. Passing more urine, also kidney failure, kidney damage. Pain while passing urine, passing blood in the urine, passing stone in the urine. These are all signs of kidney damage and they need investigations.
Got the doctor. So one cannot just think that, I don't have any issues while passing urine, and that could be the sign of absolute kidney health. That's not true. And it can have its deeper implication if a person is passing multiple times, is what you mean.
Correct.
If I can ask Dr. Deepak, while hydration is seen as the very healthy aspects of our living, does it actually prevent us from having kidney disorders? And how much of water intake is too much? Or is there an ideal water intake that everybody requires? Does one size fit for all? How much is too much when it comes to drinking water?
A very important and practical question. That too, considering a lot of water shortage, what we are facing in Bangalore, because of this summer. Hydration is a very important aspect, not only for kidneys, but for a general well-being for all the organs. Most of our body is formed by water, so we all need to take sufficient water intake. If there is a question that how much water intake is sufficient, generally 3 to 4 liters of water per day is recommended. For all the general population, or the people who are hale and healthy. But again, we day in and day out, I get to see so many patients who have kidney disease, or who have a heart disease, or who have a liver issue or a liver problem, who come and ask, can I take more water? Because it is said that it is good for the kidney, it is good for the heart, it is good for the liver. That there is a gray area there, or we need to be careful. If somebody has a kidney disease, then the water intake has to be restricted. So because kidneys are the one, as Dr. Sundar was saying, they are the one which will filter water. When the kidneys are damaged, the ability of the kidneys also to handle the water decreases. So hence we need to restrict their water intake, particularly when the kidney disease is advanced, like chronic kidney disease, stage 2, stage 3, or stage 4. That is the time wherein we advise patients to restrict their water intake. It should be as good as how much they pass urine. For example, they pass about 1.5 liters of urine. You take about 1.5 liters of urine. Don't do it in excess, because more intake of water you do, it is going to only get collected in your system, and then you have swelling of the legs, swelling of the face, water accumulation in the lungs, breathing issue, and all that happens. So for any general population, to keep it simple, general population, 3 to 4 liters of water intake is sufficient or is good enough. Taking little water or less water is harmful. It can cause kidney damage, particularly the acute kidney injury because of dehydration. When somebody has an existing kidney problem, then the water intake has to be restricted based on the nephrologist advice, because again, it should not be taken as a standard statement. Each patient will have to take probably different quantity of water based on his creatinine levels, his medications, his urine output, and so on. So he has to take advice of a nephrologist and follow that for his water intake.
Yeah, got that, sir. And also, if I can ask Dr. Sunda, one of the factors that plays a very key role in hesitation and fear towards kidney donation is a popular myth that a person needs two kidneys. We're all born with two kidneys and we require two kidneys to continue living healthy. How do you help families with potential donors who have a needy recipient in the family to understand that a person can live with one healthy kidney, and that's how you probably would take up the concept of organ donation, right? How do you convince families?
Sunita, I think this is one of the most difficult subject in our practice. In fact, I keep telling my colleagues in the medical education field that if your student can convince somebody to donate a kidney, they should get a degree, DM degree or DNB without exams. Most difficult is that. But commonly, there's a myth. You said that everybody is born with two kidneys. No, 1 in 1,000 is born with only one kidney. Our former Prime Minister, Vajpayee, had only one kidney and he became the Prime Minister. So there are a lot of people, in fact, that is one of the reasons when somebody says, I want to donate a kidney, we do an ultrasound to find out whether they got two kidney or one kidney. So in fact, the common question people ask me is, if you can donate one kidney, 1 in 1,000 is born with kidney, why has God given us two kidneys? Very good question. And my answer to that is, God has given two kidneys. One is for you, the other one is to donate for your loved ones. So this is the way God is telling you that you can be an organ donor. But you must understand, organ donation is not a simple process. Even if somebody wants to donate, we do a lot of tests to see that the donor is safe after donation. Because for us, as Deepak will agree, for us, the kidney donor is more important than even the patient. Because this is somebody who's normal, who's donating for saving somebody else. So even in a practical sense, business sense, if something happens to the donor, the entire transplant program, not of the hospital, the entire city or state or country will collapse. So we have to be very careful in organ donation. But this is a myth they must understand. 1 in 1,000 is born with one kidney, which itself shows that you can lead a normal life. But if you look at the history of organ donation, how did they know that one person can donate kidney? During war, one kidney was removed due to the injury during the war, or somebody had some tumor or some other problem, one kidney was removed in childhood, and they led a normal life. That's also the concept that one kidney you can lead a normal life. In fact, people even don't know that once you donate or remove one kidney, after a few months to few years, the other kidney will increase in size. It's all compensatory hypertrophy. It's God's creation that when you donate a kidney or kidney is removed for something else, the other kidney is normal. It can grow in size and compensate for the loss of one kidney. So in short, kidney donation is safe, done in good center. So I again say, don't say I love you with my heart, because you can't donate your heart. I always say love you with my kidney, so that you can donate one kidney and save somebody's life.
Yeah, that's interesting, doctor. So which means to say that persons living with one kidney may not even know that they do not have the other kidney, right? Unless they actually undergo an ultrasound scan for some reason at some point of time.
In fact, we did this, during the so-called kidney scam in '95. We doctors are accused of stealing kidneys. So whenever people went for any abdominal surgery, we would do a scan and show that you got two kidneys before we went for surgery. And after the surgery, we'll do again a scan, say that your two kidneys are safe. Because somebody is born with one kidney and they go for surgery and come back and they find somebody tells you got only one kidney, they're going to say Dr. Sunda has stolen one kidney. So we didn't want that. At that point of time, we did this routinely. Deepak may not know, this occurred in '95. Routinely, people going for any abdominal surgery, not kidney, we'll say you got two kidneys before going in, come back, and we were doing it free because it's for our own benefit. We didn't charge extra, and we said this is the way it is.
Got that, yeah. Dr. Deepak, if you can help us understand this better. One of the challenges among persons with CKD is the adherence to dialysis. Many discontinue dialysis and withdraw from the treatment protocol, and depression hits many persons with CKD. How do you help them to continue with the regime of dialysis thrice a week and two times a week for many? Dr. Deepak?
Yeah. See, again, a very important topic of dialysis, and adherence to dialysis. There are a couple of myths related to dialysis itself. A lot of patients do come and ask, nephrologists that, can we do dialysis for 1 month, 2 months, and then stop it? This is the first question they ask. Answer is absolutely no, because dialysis is started particularly when somebody has a chronic kidney disease, and in the later stages, what we call it as end stage renal disease. So as the name indicates, end stage. So once they reach that stage, then the options of renal transplantation bar dialysis, do come into play. And somebody is started on dialysis, they have to continue their dialysis lifelong once they are labeled as end stage renal disease. Now, after doing 2 months, 3 months of dialysis, if they stop, they would come back with the same symptoms or the same problems what they suffered before starting dialysis. So, that is an important point, which has to be stressed. So you are on dialysis, you have to continue dialysis. So that is one thing. Second is adherence. Sometimes, people do think that, okay, I can skip one dialysis. The worldwide recommendation is 3 times a week dialysis. In West they do 4 times a week, or week-long dialysis to have better clearance and better quality of life. But in India, we do 3 times a week dialysis, which is commonly done. And missing the dialysis session is going to prove them harmful. Their potassium will go up, their fluid content in the body will go up, and that can lead them to get admitted or hospitalized. So they have to be careful. Sometimes, the importance of dialysis will not be known unless, dialysis facilities are hit. Recently I had read Dr. Sundar's tweet about, hurricane, which happened in US, and a lot of people were not having that, privilege to go for dialysis because of disruption of the healthcare facility and lack of dialysis centers, and so many lost their life. That's why dialysis is important. In India, luckily, we have, morning as well. Again, I could gather something from Dr. Sunda. Every day we learn from him. He put up a picture of one nation, one dialysis program under Pradhan Mantri Dialysis program. Wherein after that entity has come into picture, a lot of patients who are not financially good can also undergo dialysis, or a lot of poor people can undergo dialysis just to save their life and continue living. So, in India, we have that, opportunity, wherein earlier days, a lot of people used to die without having dialysis. And nowadays, we have so many dialysis facilities, both private and government funded facilities to undergo dialysis. So nobody should miss dialysis, and they should adhere to dialysis.
Yeah, but between dialysis and transplant, if the person has an option to go for transplant, the option that you would suggest will always be transplant, right?
Yeah, most of the times, yes, because when you compare transplantation with dialysis, transplantation has better quality of life, better chances of survival, lesser complications as compared to dialysis, and long-term survival is better in transplant. So we would always suggest transplant for most of the patients, except for somebody who is, elderly, more than 75, and who has a lot of other issues like heart issue, and his general condition is not poor, and he cannot undergo or sustain a transplant. Then we do advise against transplant. But most of the times it is a transplantation which is always better than dialysis.
Yeah. Doctor, as you know, we're also live on our Zoom webinar, and we have a couple of questions asked by attendees. One of them is like this. A common belief a lot of people have is that those with kidney diseases need to follow a low potassium diet. Is it true or false? One of you, if you could take this question.
I will give it to Deepak.
Okay, thank you, sir. So definitely somebody with a kidney disease, kidney is an organ which excrete potassium, or which removes potassium from the body. Once there is a kidney issue, there is always chance of potassium getting retained in the body. And when you check the blood levels of potassium, it's always high. So that's why we tell or advise patients to reduce the potassium intake. And potassium is higher in specific food, like fruits, citrus fruits, coconut, and you know, yeah, and the vegetables also, if it is not leached or boiled and water is not removed. So potassium is there in most of the food, but particularly rich in citrus fruit. So we advise patients with kidney disease to reduce the intake of such food.
I think I would like to add, Deepak, to this common myth I keep
Please do,
seeing.
sir.
Potassium, they invariably are on stitch to what is called as the rock salt, pink salt, Himalayan salt. They are all potassium chloride. This is actually dangerous. Somebody with kidney failure, potassium chloride can kill the person. In fact, jokingly, my guru, late Dr. Shastri in Bengaluru would say, if somebody's got kidney failure and no money, buy them coconut water and give, because that will kill the patient. I mean, jokingly, we would say. So, as Deepak rightly said, potassium is a killer in patients with kidney failure. Normal person can have potassium. It is good for health.
Yeah.
In the sodium chloride, have potassium chloride can prevent. So in fact, we are now going on a crusade. Namakam, low salt, and we are having salt substitute. These are potassium based, but these are all for people with normal kidneys, not with kidney damage. I think that is where the myth comes. The moment you tell your grandmother you got a kidney problem, she'll say Elnir Kudubudi. Elnir is good to prevent kidney stones with normal kidneys, not with somebody with kidney failure. I think that's the myth people should understand.
That's exactly what we required from you for this webinar today, and you clarified this, Doctor. I hope the person who asked this question probably got the right answer. The other questions are like this: Can CKD be prevented? And what are the 3 must-dos every day for good kidney health?
Deepak, shall I take this?
Yes, sir. Yes, sir. Please.
See, as I said earlier, is common, but it is preventable. So if you understand that commonest cause, as Deepak also mentioned, is diabetes and hypertension. These two are the 60 to 70% of chronic kidney disease is due to diabetes and hypertension. So if you can diagnose hypertension early, if you can diagnose diabetes and treat, so good blood pressure control, good sugar control, these are 2 paramount in preventing kidney disease. Then I always say in the prevention of kidney disease is 5S in my opinion. Salt come or salt less, sugar less, sugar come, smoking, no smoking, stress, and the 5th one, smile. And I keep adding, think of Dr. Sundar S for good kidneys. Thank you.
The 5S. Well said, Doctor. Anyone would remember this acronym 5S. Another question is about another myth that we hear. People think since kidney stones are made up of calcium, they should avoid calcium in their diet. What are your thoughts on this? Does calcium that we eat, that we take in our food, does it lead to the formation of the kidney stones?
I think, Deepak, you can take it,
Yeah.
but I am a kidney stone patient myself, and I have been advised actually take extra calcium to prevent kidney stone. But what is important is the calcium in the urine. See, there is more calcium. There are conditions like hyperparathyroidism where more calcium comes in, and then you have that. So I think anything in moderation. High calcium can cause kidney stone, but that is not the main thing. So I'm sure Deepak will be able to add some on the kidney stone issue. Deepak.
Yes, sir. Generally, as we know, calcium is a very important element which is needed for the body. And as Dr. Sundar is saying, it is of prime importance also for the kidneys and also particularly for the bones. In fact, we give a lot of calcium supplements or calcium tablets, for somebody who is more than 40s or 45, particularly for the females, for the bone strengthening. So it is an important element which is needed in the diet. But if there is a situation wherein the calcium is not excreted much, or there is a defect in the calcium metabolism or excretion, then they would have calcium stones, and in them we avoid or we suggest them to reduce the calcium in the diet, and not for everyone. So it is vice versa. It is not like calcium is not causing the kidney stones, but somebody has a kidney stones due to an altered metabolism because of the calcium, and they have a kidney stone. Such people should not take calcium.
That's very informative. I must thank the person who asked this question as well. Another very interesting question I see is this: what progress have we made in India in stem cells in treating CKD?
I think it's a good question.
CKD, stem cells and nephrology, where have we gone in India?
I think where Deepak is working, Manipal Hospital, the chairman of Manipal Hospital is Dr. Balal, who runs a company called Stempeutics. And they have done a lot of work. As of now, there is no evidence to say stems can cure kidney disease. And maybe it will come some point. As of now, I don't know on a practical day-to-day situation whether that is still available or not there, in my view. That stem cell is not going to be the solution immediately. Deepak, you have any new thoughts because you're been reading and you're quite academic?
No, I agree with you, sir. Nothing more to add there, because it has been that this thought has been there for a long time, because stem cell has been used in or claimed to be used in various other diseases. So similarly, it has been there has been a concept that can it cure kidney diseases, but there is no randomized trials. It is not FDA approved yet. Far from the trials as well, human trials as well. So that's where it stands. It's still yet to become a reality. Hopefully it becomes a reality someday, and it helps in curing CKD. That's what we would all be excited about.
Thank you, doctor. There's another person asking us, is there one ideal diet for people with kidney diseases? Is there any such thing that you can suggest?
See, basically, kidney and heart, in my opinion, go together. Whatever is good for the heart is good for the kidney. So, like no smoking, having less of salt, less sugar, definitely red meat, avoiding red meat. I, being a vegetarian, I'm obsessed to vegetarian diet. I don't take too much chicken and mutton, but then they may say because I'm biased towards vegetarian. I always say there is some theory fish is good for the kidney because the fish oil is used for some kidney disease. So fish is good, eggs are good. So basically, less of salt, less sugar, and red meat. This is definitely bad. Red meat is bad for this. It causes colon cancer. So what is good for the heart is good for the kidney. This is in brief, in my opinion. I'm sure Deepak will be able to add some more the diet and the kidney.
Yes, sir. I think you have covered most of the things there. There is nowadays you have a lot of online information as well for the kidney diet about diet which is needed for the kidney disease. But what is important here is the kidney the diet changes as the kidney disease progresses, or it changes for different types of kidney diseases as well. So when you meet a nephrologist, they would obviously advise a specific form of diet along with help of dietitian for that particular patient. I think we need to follow that or stick to that.
I think
thank you so much. Please continue, doctor.
It's also very important. There's the food fats like keto diet, Atkins diet. Some of them, they're all very high protein diet. They take 3 to 4 grams per kg. So 60 kg man takes 200 grams protein. I somehow don't like that. Somebody with normal kidney is okay, but somebody who's got even a mild kidney problem, I keep seeing quite a few bodybuilders where creatine is high and they take creatine with kidney failure. So I am not for that sort of high protein diet, in my opinion. But some of the dietitians have taken against this. And they keep trolling me, saying that no, nothing will happen. Nothing will happen if your kidneys are perfect. But I feel that sort of high protein, whey protein, taking 3 to 4 grams per kg. So somebody wants to become, muscle man, that sort of thing, is not good for the kidney, especially if somebody has got a kidney problem. It is not advisable, in my opinion.
Correct.
In the last half an hour, we have learned so much about, the ways to keep our kidneys healthy, what to do, what not to do, how bodily water cannot reverse your diabetes, and how potassium-rich tender coconut is not for persons with CKD and things like that. I hope our takeaways from the webinar today is proactive kidney screening that one must not ignore. So thank you, Dr. Sundar and Dr. Deepak, for your very insightful explanation and your time that you gave us today amidst your busy schedule as nephrologists. So we really hope this session helps clearing doubts for many persons living with kidney issues, their family members, and anyone who believes in healthy, happy living. So with this, I'm Sunita Rao, wrapping the session. Read and watch www.happiesthealth.com for better knowledge and better health. Thank you once again, Dr. Deepak and Dr. Sunda.